22% of individuals stay in the gap. And only 4% of Part D enrollees end up spending enough money so that they're eligible for the catastrophic coverage. Medicare does not cover everything. It doesn't cover deductibles or co-insurance. Some particular prescriptions are not paid for in Part D because they're not covered by the drug formulary. Vision, hearing, and dental care are not covered, and these are tremendous problems for the elderly. Long-term nursing home is not covered by Medicare. And if somebody can afford it, they try to buy what's called Medigap insurance to cover these deductibles and the things that aren't covered by Medicare. Medicaid is a different program. It is state-run, and it's funded by federal and state dollars. There are 50 different plans. Every state has a different one. They are required to cover low-income women and children. It's public insurance for the portions of medical expenditures that are not covered by Medicare for low-income elderly. Most people who are low-income and disabled are covered by Medicaid. And nursing home expenditures of many institutionalized elderly are covered, but the elderly have to get rid of all their assets before they can qualify for this. Poor Michiganders are eligible for Medicaid if it's an infant, if the family makes 185% or less of the federal poverty level, the child 150% or less, pregnant women 185% of the poverty level. Unfortunately, many people are too rich for Medicaid, but they're too poor to buy health insurance privately. The Children's Health Insurance Program is the third program that has been established to help people with health insurance. Health insurance for families who are too rich for Medicaid, but too poor to purchase private insurance. And I've given you statistics as to what's covered. Those families with low or moderate incomes. You have to be under age 19. It costs about $10 a month. There's some minimal cost sharing for families, but there's no cost sharing for preventive care, including immunization. Now, between Medicaid and CHIP, we cover about 1/3 of all children. So 2/3 of children who are in poverty are covered. There's about 29 million children on Medicaid and 7 million on CHIP. But 75% of uninsured children who are eligible for Medicaid or CHIP are not enrolled. All right, the U.S. healthcare system is expensive. We spend more on our healthcare than any other industrialized nation. We have many resources, but we get less bang for our buck. We're very reliant on technology. 30 years ago, there were 3 million CAT scans. Today, annually, there are about 80 million. They're expensive, and they don't buy better care. If you look at these data, and I'm sorry that the top line doesn't show up too well, but it's the percent of GDP spent on health. And you can see Canada spends 10.1, France 11.0, Germany 10.4, United Kingdom 8.4, and we spend 15.7. Now these are old data, they're from 2007, but I wanted to get comparable across these countries. We look at life expectancy at birth, we're the pits, we're the lowest on the list, with 77.9. Similarly, we have the worst infant mortality rate. That's the number of deaths per 1,000 live births of any of these countries. It's 6.4. So on comparable data, we're not doing well. Why no bang for our buck? Well, we're spending too much on high technology, on administration, on expensive drugs, and testing, and unnecessary surgery, and using the emergency room for non-emergency. People often do that because they have no primary care provider, so they go to the emergency room if they have a bad cough or an earache or a sore throat. We spend too little money compared to other countries on prevention. Evidence-based medicine. Now, evidence-based medicine means that you provide scientifically proven care for a specific illness. So instead of taking kind of the big expensive drugs and the big expensive technology to treat a condition, you look at the data and see what is most effective and use the most effective, least costly alternative. We don't spend much money rewarding performance, so we're not rewarding physicians that have diabetic patients whose blood sugar is under control. We don't reward patients. We don't reward physicians who are taking care of patients who have high blood pressure that's kept under control. We spend too little on primary care. 90% of health care can be provided by primary care practitioners. We have far too many specialists. And we don't spend much money on fixing health disparities across social groups. In 2009, we spent $2.5 trillion on health care. So it's now up to 17.6% of our gross domestic product, or over $8,000 per person. And by 2019, the health share of the GDP is projected to be 19.3%. We have documented as medical sociologists that there's inequality both in health as well as access to care. Specifically, there's inequality across social groups in health status, in disability, in disease, in death, in access to health care, and receipt of high-quality, effective care. If you look at life expectancy births at 2007, you'll see that black males barely, on average, would be expected to live to age 70, whereas white females are living above 80. White males and black females are in between. Infant death. Our infant death rate for whites per 1,000 live births is 5.64. For blacks, it's 13.24. For American Indian and Alaskan Native, it's 3.1. For Asian and Pacific Islanders, it's 4.9. Hispanics or Latino, it's 5.6. The infant mortality rate for blacks is more than double that of whites. If you look at cause of death, and these are black-white ratios, all these conditions occur more commonly among blacks and cause death. So heart disease, the ratio is 1.3. Malignant neoplasms, which is cancer, is 1.2. Cerebral vascular disease or stroke is 1.5. Diabetes is 2.1. Hypertension and hypertensive renal disease is 2.5. Homicide is 5.7. If you look at 5-year cancer survival rates, you'll see that blacks are less likely to survive 5 years after diagnosis of prostate cancer than whites. White women survive uterine cancer for 5 years more often than black women. And breast cancer, there are also disparities. This is attributed to the fact that they are diagnosed with the problem later in the stage of the disease, and they don't get as aggressive treatments. We look at the percent without health insurance coverage from 2009, and this is again from the Kaiser Family Foundation. You'll see that while non-Hispanic whites, only 14% are not insured. African Americans is 23%. American Indians, Alaskan Natives, 28%. Asians, 18%. Hispanics, 34%. We know that minorities and poor have less access to health services, especially primary care and prevention. They have delayed treatment. Minorities and poor have lower quality of acute and long-term care, and that minorities and poor tend to get care from the public sector, and their services are unequal compared to what you can get from private physicians and hospitals. Now, one of the things that's happened a year ago almost was the signing of the Patient Protection and Affordable Care Act by President Barack Obama.